Hi, I'm Dr. Bill Burman. I'm the Director of Public Health at Denver Health. The overall COVID situation in Denver continues to slowly improve. Our case rate's been headed down fairly steadily. We always look at the percent of tests that are positive. That's also stabilized at about 4%, and that's under our goal of being under 5%. So I think overall COVID is coming down, but still is active in our community. I'm happy to say that COVID rates in particular populations that are very important for DPS are improving. So COVID rates among young adults are decreasing. And in this past week, COVID rates among middle and high school students also started to decrease. So overall, continued transmission, but improving steadily. Yes, there's lots of interest in being able to expand vaccination to younger children. We're approaching 40% of 16 and 17-year-olds in Denver County having been vaccinated. That's great progress. We're expecting within the rest of this week or early next week to get approval from the FDA to expand vaccination down to age 12 with the Pfizer vaccine. So within the week, we hope to be vaccinating down to age 12. The best way to protect the youngest children from COVID are first the basic prevention measures we've all been practicing for the past over a year now of masking when out in the public, particularly indoors, washing hands, distancing to the extent that's possible, and now vaccination. The way to protect the youngest children until we can vaccinate them is to vaccinate those around them, particularly the adults around them. So parents, families, grandparents, aunts, uncles, the more of those people who are around young children that we can get vaccinated, the more we'll protect those children. Yeah, vaccine rates in Denver across the whole country have decreased. I think that's because we've vaccinated many people. Again, we're up to almost 2/3 of the eligible population in our community has started vaccination. So there are fewer people who need to be vaccinated right now. Also, we need to work with populations that had trouble accessing vaccine in the first few months of vaccination. Those who don't have internet connections, aren't connected to medical care systems, may be concerned about sharing information around themselves to be vaccinated. So I think that's where our effort lies. So I'm not overly concerned with the decrease in vaccination rate. We knew this would come. I think the good news is we have plenty of vaccine. There are no vaccine shortages for any of the 3 approved vaccines. And so we can now offer vaccinations to anyone who's in the eligible age criteria. So for example, Denver Health now allows anybody from across the community to sign up for a vaccine, to make their own appointment with the vaccine that they want right on the website. You don't have to call, you don't have to sign up for Denver Health. Anyone can just pick out their appointment for vaccination. So that's one of the ways that now it's getting to be much easier to be vaccinated. Another is that an increasing number of vaccine sites are allowing walk-up or drive-up. Registration is still helpful, but for those who aren't able to or have concerns about registering, it's possible to just walk up and drive up to an increasing number of vaccine sites.